Good evening, everyone. Today, I would like to discuss the article which was published in Lancet, nicotine patches used in combination with e-cigarettes with and without nicotine for smoking cessation. This was published in Lancet last year. The study was done in New Zealand National Institute for Health. So, coming to the background, nicotine replacement therapy helps reduce the nicotine withdrawal symptoms of people who quit smoking. However, no NRT available matches the nicotine concentrations and rapid delivery achieved with the smoking. E-cigarettes should be offered as one of the main adjunct smoking cessation strategies for those people who want to quit the smoking. The Cochrane review of e-cigarettes for smoking cessation showed that nicotine e-cigarettes significantly increased the smoking abstinence at 6 months compared with nicotine-free cigarettes. Although absolute quit rates were low, 9% versus 4%. And this was the first trial to investigate the effectiveness and safety of combining nicotine patches and second generation e-cigarettes on the smoking abstinence. Coming to the methods, this was a community-based study which was done in the New Zealand, and the study period was between March 2016 and November 2017, and the population taken was 18 years and above who smoked tobacco. The amount was not specified, and who were motivated to quit in the next 2 weeks, and only one person per household was selected. And the design was parallel group pragmatic 3-arm randomized trial. And the exclusion criteria was pregnant breastfeeding women, history of prior e-cigarettes for smoking cessation for more than 1 week in the past year, or enrolled in any other program, and uncontrolled asthma or cardiovascular diseases. So methods were 1623 people were assessed for the eligibility, out of which 1124 people were taken and were randomized using stratified block randomization using 1:4:4 ratio. So there were 3 arms: nicotine patch, 21 milligram, that is a 24-hour patch. So 125 patients were there in this arm. And the second arm is the nicotine patch plus nicotine e-cigarette, where 500 patients were included. And the third arm was nicotine patches plus nicotine-free e-cigarette. The 499 patients were included. So along with this, the moderate intensity behavioral support was done once in a week for 6 weeks. And the 15 minutes of withdrawal-oriented sessions were taken on telephone calls. And the variability of plus or minus 10% nicotine concentration was acceptable. All data were collected telephonically, and for primary analysis, intention to treat approach was used, whereby participants with unknown smoking status were deemed to be smoking. So analysis was, the primary outcome was the continuous smoking abstinence 6 months after the agreed quit date. The abstinence were verified by the mainly using standardized exhaled carbon monoxide measurement by Bedford smokerlizer. Less than 9 parts per million were taken. The secondary outcomes were assessed at quit rate 1, 3, 6 and 12 months after the agreed quit date. These were the secondary outcomes: continuous abstinence, carbon monoxide verified at 12 months, 7-day point prevalent abstinence, relapse, self-reported treatment adherence, tobacco withdrawal symptoms and urge to smoke and urge to vape, self-reported weight, any concomitant medications were used, and other smoking cessation support or medication was ongoing, and the treatment crossover. So coming to the results, so out of the 3 groups, the patches plus nicotine e-cigarette, so this was the continuous CO verified quit rate at 6 months was 7% versus 2%. So which was the p-value was 0.05. So no significant difference in 6-month verified continuous abstinence rate between the patches plus nicotine e-cigarette and patches only group was observed. The p-value was 0.05. So coming to the next group, nicotine e-cigarette plus patches versus nicotine free e-cigarette plus patches. So the difference of the primary outcome CO verified quit rate at 6 months was 7% versus 4%, which was statistically significant. So coming to the adherence was high at the quit date. Almost 90% of the participants in all the 3 groups reported patch use, and 94% reported e-cigarette use, and 85% reported both products, but decreased over time. By 3 months, only 50% of the participants in all 3 groups were still using patches, while 67% were still using e-cigarette and 56% were still using their nicotine-free e-cigarette. In the e-cigarette groups, only 33% of the participants were using both of their allocated products at the 3 months. So initially adherence was high, coming by going by 3 months and 6 months, the adherence was slightly going down. So 18 serious adverse events were occurred in 16 people in the patches plus nicotine e-cigarette group, compared with the 27 events in the 22 people in the patches plus nicotine free e-cigarette group, and 4 events in the 3 people in the patches only group. So in the patches plus nicotine e-cigarette group, 2 life-threatening serious adverse events were reported, mainly 2 separate heart attacks in one participant. So coming to the follow-up, almost like 30% of the participants in each of the 2 e-cigarette groups and 42% in patch-only group were lost to follow-up at the 6 months. So mainly people younger than 40 years and who had low level of education had a quite significant amount of follow-up. So coming to the discussion, this trial found that the combination of nicotine patch plus e-cigarette was superior to patch plus nicotine-free e-cigarette for 6 months smoking abstinence among dependent smokers who are motivated to quit. So the main drawback of this study was the 1800 people were the sample size and only 1100 people were recruited, and it was small sample size than anticipated, so quit rates did not reach the significance. However, quit rates at 1 month and 3 months in the e-cigarette groups in the current study was almost twice those reported in the 2 earlier trials. Despite higher proportion of participants in the patch only group using the patch, 6-month absolute quit rates for only patch group were low, but similar to those observed in the over-the-counter nicotine replacement therapy. So this trial was on comparison with USA-based trial, the abstinence at 6 months was high. Compared to the UK trial, the higher self-reported 6 months was almost like lower than the 35% in the e-cigarette and 25% in the patch group. So the strengths are broad entry criteria with similarity to real world. Weakness was it's the smaller than the sample size, and the funding was a big problem. So in summary, the patches and the e-cigarette is not sustained by most people trying to quit. So patches plus nicotine e-cigarette group can be used for smoking cessation, could result 3 to 700 per 100 more smokers quitting long term than with the monotherapy. So future e-cigarette trials should focus on their use alone or in combination with usual smoking cessation support, given issues with the differential loss to follow. Thank you.